This is Audible.
Next up, preserving your skin. The skin is the fastest growing and largest organ in our body, about 20 square feet, accounting for about 10% of our body weight. It acts as the most conspicuous mirror of the aging process. As our skin becomes thinner, it's more easily damaged, loses volume and elasticity, and can sag and wrinkle. The three main constituents that make up the bulk of our skin are collagen, hyaluronic acid, and elastin. Collagen, which makes up about 75%, contributes strength and firmness. Hyaluronic acid maintains moisture in the skin by trapping water, and stretchy elastic fibers containing elastin make up about 1 to 2% of our skin and help it bounce back into shape. As we age, the synthesis of collagen and elastin decreases by about 1% a year, as does overall skin thickness. The turnover rate of our skin can slow considerably, from every 28 days in the young to 40 to 60 days in the elderly. Our skin's microbiome also changes, in fact, so predictably that people's age can be guessed within about a 4-year range just from a swab of the bacteria on their skin. We don't yet know enough about these bugs to assess their role in the skin aging process, though, which seems to revolve around oxidative stress. That's what causes age spots, also known as liver spots, clumps of oxidized fat and proteins known as age pigments or lipofuscin, from the Latin lipo and fuscus, meaning dark fat. Nothing new under the sun. As little as 3% of skin aging is due to genetic factors, so-called intrinsic aging, and the rest, extrinsic aging, is from our lifestyle, that is, from what we do to our skin. You can get a sense of the difference by comparing the aging of skin from typically protected areas to skin that's been exposed to the sun. The skin on your tush or the inside of your upper arm, for instance, compared to the skin on your face or hands. Intrinsic aged skin does lose elasticity and develops fine wrinkles, but it's generally otherwise smooth and unblemished, with pigment diminishing towards pallor. Extrinsic aged skin, on the other hand, can become leathery, bumpy, blotchy, and mottled with coarse wrinkles and furrows. Between 80 and 90% of facial aging among people with lighter skin tones is due to sun exposure. Those with darker skin are also affected, though they're relatively protected due to their built-in melanin sunscreen. That's why dermatologists now agree there's nothing more important to slow the signs of aging than to protect your skin from the sun. To illustrate, a dramatic photo of a trucker who spent decades getting more sun on the left side of his face through his driver's side window was published in the New England Journal of Medicine, making him look a bit like a Batman villain. You can check it out at c.nf/trucker. Factors like sun exposure and smoking can make people look 11 years older. Cosmetic surgery, on the other hand, can make people look up to 8 years younger. A healthy lifestyle may work even better at maintaining a youthful appearance. Protecting our skin from the sun should be a lifelong endeavor. This can involve sunscreen, wearing sun protective clothing, hats, and sunglasses, and avoiding direct sunlight during the peak hours of 10 a.m. to 4 p.m., instead seeking shady, covered areas. Sunbathing is frowned upon, even with sunscreens like zinc oxide or titanium dioxide, which offer broad-spectrum protection against both UVA and UVB rays. We now know that other wavelengths not covered by sunscreen, such as near-infrared, also contribute to skin aging. Men and women who use tanning beds appear significantly older than those who don't, and those who sunbathe appear years older than they actually are, comparable to what is seen with smoking. Something in the air. Beyond the oxidizing effects of rays of the sun are the oxidizing effects of oxygen in the air, as well as cigarette smoke, automobile exhaust, and other environmental pollutants. Cigarette smokers develop a distinctive pattern of prominent wrinkles known as smoker's face. The effects are so significant that illustrating these aging effects can help smoking teenagers quit. Compared to only 1 out of 80 teens quitting in the control group, 11 out of 80 teens who had been shown digital aging software presenting their future faces with and without smoking were successfully able to quit. A similar study presenting the deleterious effects of UV rays on facial images appeared to affect sustained behavioral change in regards to sun tanning practices. Even ambient air pollution has been correlated with signs of skin aging. Poor air quality index is significantly linked with age spots, increased wrinkling, and skin sagging. This is blamed on polycyclic aromatic hydrocarbons, or PAHs. These combustion byproducts coat diesel exhaust particles and are also formed when coal is burned, tobacco is smoked, and meat is grilled. Tobacco smokers get about half their exposure to PAHs from cigarettes and the other half or so from food. For non-smokers, though, 99% of their PAH exposure may come from their diet. The highest levels of these chemicals are found in meat, with pork apparently worse than beef, but even dark green leafy vegetables can get contaminated by pollutants in the air. So don't forage your dandelion greens next to the highway, and make sure to rinse your greens under running water. Since PAHs are fat-soluble, absorption of these chemicals may be diminished by eating foods that are lower in fat. However, they do not appear to build up in our body, unlike persistent pollutants like PCBs, which may take 50 to 75 years to clear from the body after regularly eating farmed Atlantic salmon, for example. PAHs can pass through us in a single day. After eating a meal of barbecued chicken, a big spike in these chemicals can be seen in the diner's systems, up to 100-fold increase. However, the body can detoxify most of the PAHs away within about 24 hours. Instead of detoxing, wouldn't it be better not to tox in the first place? A recent Dermatology Review article ended with the summary, quote, "In conclusion, when patients inquire about a diet that might contribute to younger-looking skin, evidence supports the recommendation to follow a whole-food, plant-based diet," unquote. Medical skin treatments. Anti-aging medicine is one of the fastest-growing medical specialties and often targeted at women who are urged to restore their youthful appearance by any and all available means. 92% of cosmetic procedures are performed on women, most commonly Botox, fillers, and laser or chemical peel skin resurfacing. Each year, millions in the United States undergo cosmetic surgery, including hundreds of thousands of facelifts, known technically as rhytidectomies. Losing face. In c.nf/facelifts Botox, I detail what we know about facelifts. Basically, none of the techniques have been shown to be definitively better than others, and they're considered to be relatively safe when performed by a board-certified plastic surgeon. In the video, I discuss all the complication rates and the importance of tempering expectations. Hitting the headlines. In the same video, I also cover Botox injections, the most common non-surgical cosmetic procedure. In some, adverse effects are transient and self-limited, but the increase in injections administered by non-medical personnel raises concerns about a potential rise in extremely rare cases of respiratory failure and death, occurring hours or even weeks after injection. Filling your face. In c.nf/fillers, I cover the second most common cosmetic procedure, volumizing injections of soft tissue fillers. Adverse outcomes occur in about 1 in 40 procedures, most commonly bruising, discoloration, swelling, or unsightly lumps and bumps. The most devastating filler complication is permanent blindness due to an accidental injection into an artery. More about this in the video, along with similar concerns about the increasing administration of fillers in spa-type rather than medical settings that may use illegal, non-FDA-approved fillers. There have been reports of injections with everything from rubber cement to fix-a-flat tire repair sealant, resulting in disfigurement and even death. Peel out. Another common cosmetic procedure is the chemical peel. About 1 million are performed every year, along with another 1 million laser skin, quote-unquote, resurfacings, to provide a, quote, controlled injury to the face, unquote. The reasoning is that the regeneration, repair, and remodeling of the damage caused to the skin can result in a more tightened appearance, but peels and laser resurfacings may or may not actually help with wrinkles. The inflammation caused by these types of facials causes edema, fluid retention, in the face, which, because of the swelling, can cause a transient improvement in the appearance of fine wrinkles, but in the end may do more harm than good. Short-term side effects include bruising, swelling, itching, crusting, redness, infection, acne, and milia, which are little white cysts. Long-lasting side effects can include persistent redness, pigmentation changes, and scarring. Dietary skin treatments. Some animals use diet to increase their sexual attractiveness. Great tits, distinctive olive-and-black songbirds ubiquitous throughout Europe and Asia, tend to prefer carotenoid-rich caterpillars, which makes their breast plumage brighter yellow to become more appealing to potential mates. Might there be a similar phenomenon in humans? Tanning bed of greens. When researchers showed study participants digital photographs of Asian, African, and Caucasian women and men, and asked them to turn a dial to manipulate the skin tone of their faces until they felt the healthiest-looking color was reached, both female and male subjects preferred the yellow so-called golden glow that can be achieved through dietary carotenoid deposition in the skin. As I review in c.nf/glow, the healthier you eat, the healthier you may look, but the increase in facial attractiveness from eating more fruits and vegetables may drop within weeks once you stop, so you have to keep it up. There's an entire tanning industry predicated on the belief that darker Caucasian skin appears to be healthier, more attractive, but research suggests that the perceived improvement in appearance from tanning is due to the associated increase in skin yellowness. When you separate out the shade from the hue, study participants actually preferred lighter but yellower skin. When high kale models were pitted against high tan models, the golden glow from consuming carotenoid phytonutrients won out. So may I suggest the produce aisle to get a good healthy tangerine? Save your skin. I am not above appealing to vanity, especially for younger individuals for whom surveys suggest eating to improve appearance trumps eating for better health. So I'm always excited when I see articles embrace studies with headlines like "Greens to be gorgeous." Fruits and vegetables don't just change our hue, though. As I document in c.nf/internal sunscreen, skin biopsies from women effectively randomized to a daily spinach salad showed a significant increase in collagen production, accompanied by an increase in skin elasticity and a decrease in facial wrinkles. This may have been due in part to an inside-out sunscreen effect, as less DNA damage was noted after the same degree of UV radiation. Kale, apple, and a combination of rosemary and grapefruit extracts had similar effects. Even just 10 weeks before swimsuit season, but not 4, eating a lot of antioxidant-rich foods such as tomato paste can reduce the redness of a sunburn by 40%. Topical sunscreens and dietary photoprotection with foods like greens and sweet potatoes naturally complement each other for safeguarding our skin. The sunscreens have the advantage of working almost immediately and offering much stronger shielding, while produce protection builds up slowly over weeks and only achieves an SPF of 4, compared to 10 to 40 or even higher with typical sunscreens. On the other hand, sunscreens have to be deliberately applied in sufficient amounts with sufficient coverage, including all the hard-to-reach places, and then can still rub off, wash off, or be sweated off, whereas the protection from plants is ever-present and built in all over. Antioxidant dynamics. Antioxidant levels in our skin are ever-changing hour to hour. Remember that argon laser study I talked about? Similar technology has been used to show a tight correlation between low antioxidant levels in the skin and the presence of facial furrows and wrinkles. This is consistent with data showing significantly less skin aging over a 15-year period among those eating high antioxidant versus low antioxidant foods. This constantly fluctuating balance between the antioxidants we deposit in our skin from our diet and the onslaught of daily oxidant stresses sapping our reserves can provide insight into some other lifestyle behaviors that can affect skin health. For example, don't forget your beauty sleep. Compared to individuals getting 8 hours of sleep, participants who were kept up for 31 consecutive hours and allowed only 5 hours of sleep were rated as having redder eyes, more swollen eyes, darker circles, hanging eyelids, paler skin, more fine lines and wrinkles, and droopier corners of their mouths. Those who are sleep-deprived are also perceived as being more tired, less healthy, and less attractive than the well-rested. Over time, the oxidative stress associated with sleep deprivation could potentially translate into long-term differences in skin aging parameters. Psychological stress may also affect skin aging. Higher stress hormone levels are associated with increased perceived age. Think how U.S. presidents look before and after one or two terms in office. In an aging study out of Boston, hundreds of participants had photographs taken over a 10-year time span. Those under financial stress, even after controlling for income and health and attractiveness, were rated as looking significantly older than they were at baseline and aging significantly worse over time. Antioxidant dynamics may also explain why alcohol consumption is linked not just to digestive tract malignancies, but to skin cancer too. As I note in C.NF/Sun alcohol, after drinking about 3 shots of vodka, the level of carotenoid antioxidants in the skin drops dramatically within 8 minutes, which translates into sunburn susceptibility that can be mediated by drinking it with orange juice. But berries are even better, so a strawberry daiquiri may lessen sunburn even more than a screwdriver. Alcohol consumption does not appear to affect skin aging, though. One study found a significant correlation between skin wrinkles and alcohol consumption, but 10 others found no significant association in either direction. What about other beverages? Skin drink. Perhaps not surprisingly, whole-body dehydration is associated with dry eye syndrome, a condition that disproportionately affects the elderly. What about hydration and dry skin? A systematic review found that studies showing drinking an extra 1 or 2 liters or quarts of water a day for 4 to 7 weeks may improve skin hydration and decrease symptoms of skin dryness and roughness. What about tea or coffee? Skin biopsies taken before and after drinking tea show that green tea compounds are deposited in human skin, but to what effect? The drinking of coffee, or both tea and coffee, is associated with fewer pigmented spots on the faces of Japanese women, but interventional studies are either absent in the case of coffee or disappointing in the case of tea. Skin biopsies show that a combination of oral and topical green tea increases the elastic tissue content of skin compared to placebos within 8 weeks, but not enough to be noticeable to the naked eye. EGCG, one of the active components of green tea, can reduce UV-induced skin damage in rats, but when put to the test over 3 months in people, green tea supplements with the EGCG equivalent of 11 cups of tea a day showed significant photoprotection, though the equivalent of 5 daily cups of tea did not. Maybe the study period just wasn't long enough? A 2-year double-blind randomized placebo-controlled trial found a significant improvement in the overall solar damage, redness, and telangiectasias, or spider veins, on the sun-exposed arm skin of women randomized to consume the equivalent of about 2.5 cups of green tea a day, but the same was also found in those randomized to the placebo group. In other words, just being part of the clinical trial may have led the women to change their sun exposure activities and benefit regardless. In C.NF/topical tea, I cover an extraordinary case report that suggested the topical application of green tea could prevent skin cancers, presumably due to the decreased UV-induced skin damage, but for those not at particularly high risk of skin cancer, topical green tea is considered to be too irritating to be used routinely. Once you already have basal cell carcinoma, applying a 10% green tea ointment doesn't seem to help. An herbal tea that may help is a soothing South African infusion called honeybush, also known as cyclopia. After it was found to protect the skin of so-called nude or hairless mice from UV damage, water extracts of honeybush were tested in a randomized, double-blind, placebo-controlled trial. Rather than coming up with a placebo tea that looked and tasted the same, the honeybush tea was dried and powdered into capsules to pit against indistinguishable placebo pills. So it's not clear how much tea was actually being tested, but after 12 weeks, it decreased eye wrinkle volume by about 28% more than placebo. The other anti-wrinkling beverage may surprise you: hot cocoa. After drinking a beverage with about 2.5 teaspoons of natural cocoa butter, subjects had a significant increase in blood flow within the skin within 2 hours. Drink it every day for 6 weeks, and the redness to the same UV dose is down by 15%, and after 12 weeks by 25%. Skin thickness, density, and hydration also improved compared to placebo, a cocoa from which most of the flavonols have been removed. No change was found in wrinkle severity after 12 weeks, but a 24-week study found a significant improvement in skin elasticity and a decrease in wrinkle depth just from adding less than a tablespoon of cocoa powder to their daily diet. A sidebar: Wrinkles should merely indicate where the smiles have been. Mark Twain. Wrinkles occur where fault lines develop in aging skin, a process comparable to breaking in leather gloves. Over time, the skin folding caused by everyday facial expression etches the temporary grooves into permanent wrinkles. In C.NF/wrinkle formation, I cover the role of Botox, so-called anti-wrinkle pillows and adhesive strips, genetics, and even the light emitted by smartphone screens. Of course, kids can scrunch up their face all they want because the architecture of their skin has yet to be irreparably damaged. So the key to preventing wrinkles is preventing the underlying structural damage that makes your skin susceptible to them via choices such as tobacco avoidance and regular sun protection. An anti-wrinkle diet. If you already have some wrinkles, is there any diet that might reduce them? While a predominantly meat and junk eating pattern was associated with more wrinkles, both a fruit-dominant diet and one with more fruits, vegetables, and nuts were associated with significantly less wrinkling. I'll run through all the specific foods associated with more or less wrinkling in C.NF/anti-wrinkle, without the hyphen, as well as the interventional data on almonds, flax, soy, and mangoes, yay, and nay, respectively. The paucity of interventional trials limits the confidence one can put in recommendations, but the best approximation were summed up in a 2020 dermatology review titled, quote, An Anti-Wrinkle Diet, unquote. Dietary defense strategies included antioxidant-rich foods, as I've talked about before, anti-inflammatory foods, anti-glycation foods, fiber-rich foods for our microbiome, foods like broccoli that boost DNA repair, and foods shown to be able to block collagen and elastin-munching enzymes, at least in vitro, such as garlic, turmeric, and ginger. In other words, the best approximation for an anti-wrinkle diet is one that's centered around whole plant foods. Vegan vulnerabilities. One would expect that plant-based diets might be ideal for preventing or reversing skin aging, but there have been a series of studies that expose some potential vulnerabilities. For example, the skin of vegan patients were found to be more vulnerable to inflammation in a study of phototherapy for psoriasis. Phototherapy typically involves the combination of light-sensitizing drugs with a UV lamp or laser light. After 8 weeks of treatment, significantly more vegans, 42%, ended up suffering severe redness as a side effect when compared to vegetarians, 17%, or omnivores, 10%. Why might that be? Because the vegans came preloaded with furocoumarins, photosynthesizing compounds found naturally in certain fruits and vegetables, such as parsley, parsnip, celery, and citrus. The vegans in the study were reportedly eating 1.3 pounds, 600 grams, of parsley a week. That's 6 cups of parsley in 7 days. They also ate 10 pounds of citrus, including 2 pounds of lemons, and pounds of parsnips and celery each week. It's great that they're getting such healthy produce, but these furocoumarin-rich foods could certainly make your skin more sensitive to getting sunburned. Another phototherapy study, this time to destroy precancerous skin lesions, also found more severe skin inflammation in the vegan participants, as well as prolonged healing times. In the omnivores, the average healing time to wound closure was about 10 days, which is considered normal. Complete skin healing in the vegans, however, took more than twice as long, 22 days. A protraction of healing and poorer results were also found in both laser tattoo removal in vegans, average healing time of 23 days compared to omnivores, average healing time of 19 days, and ablative laser skin resurfacing. This could be due in part to excess photodamage from eating more photosensitizing produce, but vegans also seem to have delayed healing of wounds unrelated to light exposure. In a comparison of post-surgical scars from excision of skin cancers between vegans and omnivores, the vegans didn't seem to heal as well. Reduced collagen synthesis was suspected. Collagen is not only the major component of skin in general, but it's also the main connective tissue directly involved in wound healing. Impaired collagen synthesis could also explain why cosmetic fillers are longer-lasting in omnivores, since the mechanical stress of filler injection works by boosting collagen synthesis, and why micro-focused ultrasound skin treatments seem to work better. Intense focused ultrasound is used to treat sagging skin by generating temperatures up to 140 degrees Fahrenheit to trigger a repair process that involves new collagen formation. The researchers suggest that less collagen production would explain why vegan patients experience significantly less improvement. do those eating plant-based diets really make less collagen? Apparently so. Collagen synthesis rates appear to be about 10% lower in vegetarians. The question is why? In every single one of the aforementioned studies that measured vitamin B12 levels, the vegan participants were found to be deficient, averaging less than 200 picograms per milliliter. And both human and animal studies show that vitamin B12 is important for collagen synthesis and wound healing. Homocysteine, a toxic byproduct of B12 deficiency, appears to impair collagen cross-linking, which confers connective tissue mechanical integrity. It's critically important that everyone consuming plant-based diets include a regular, reliable source of vitamin B12, as I've already talked about. Another potential contributor is increased protein needs during wound healing. For example, for those trying to heal pressure-induced skin ulcers, recommended protein intake goes from 0.8 grams a day per kilogram body weight, which is approximately 0.4 grams per pound, up to 1.25 to 1.5 grams per kilogram, which is closer to 0.6 to 0.7 grams per pound. This explains why most of a dozen studies of protein supplementation for pressure ulcers found a greater reduction in ulcer size with supplementation. Vegans average about 1 gram per kilogram a day, which is more than enough protein for day-to-day needs, but omnivores average about 1.3 grams per kilogram, so they may already be getting the excess protein that could be helpful during wound healing. So while recuperating from your next tattoo removal, I would recommend vegans up their legume intake. Collagen supplements. Oral collagen supplementation has become quite the trendy treatment for skin aging, available in an array of pills, powders, and products from bars and gummies to collagen-fortified coffee and beer. Social media is said to be inundated with paid ads marketing unsubstantiated claims. What claims, if any, can be substantiated? I review all the studies on collagen supplementation for skin aging in my video, c.nf/collagen. In short, most of the studies have been funded by collagen supplement manufacturers, and the overall quality of evidence has been considered by reviewers to be limited, contradictory, not particularly robust. A 2022 review titled Myths and Media in Oral Collagen Supplementation for Skin, Nails, and Hair in the Journal of Cosmetic Dermatology concluded, quote, dermatologists should be aware of the unsubstantiated proclamations of collagen made by companies that surpass any evidence currently supported by the literature, unquote, and that given insufficient evidence, quote, collagen cannot be routinely recommended, unquote. The evidence is considered, quote-unquote, particularly unconvincing, another review determined, when compared to methods more definitively shown to have a positive impact on skin collagen, such as sunscreen use, smoking cessation, and a healthier diet. In c.nf/collagen diet, I describe how to stimulate your own collagen synthesis, for example, by ensuring a daily vitamin C intake of at least 95 milligrams, which is higher than the current recommendations. So we don't have evidence that collagen is superior to other proteins for skin aging. If you do want to try it, consumers are advised to contact the manufacturers to clarify sources. Most collagen supplements don't disclose that information, and for good reason. Terrestrial sources of collagen can include a witch's brew of duck feet, frog skin, kangaroo and rat tails, alligator bones, and horse tendons. Aquatic sources are mainly from the skins, bones, head scales, fins, and entrails of fish. Recommended questions for manufacturers include what measures were used to protect against contamination or adulteration, if sourced from fish, were low-mercury fish used, if sourced from cows, what steps were taken to ensure no brain or nervous system matter was included in order to prevent prion disease. In the United States, collagen is exempt from FDA prohibitions against using risky tissues like brains that are intended to protect consumers against bovine spongiform encephalopathy or mad cow disease. For food safety, religious, ethical, or allergy reasons, there have been calls for non-animal sourcing. For example, 2 to 4% of the population is allergic to bovine collagen. To solve the mad cow conundrum, there have been calls to genetically engineer cattle without prions to, quote-unquote, offer a safe source of collagen-based materials. But why not just get plants to make it? A technique has been developed to produce collagen from plants, but it has not yet reached commercial viability. It's hard to beat the cost of feet. Topical skin treatments. Over-the-counter, quote-unquote, anti-aging products constitute a billion-dollar industry. There's a quote-unquote psychological effect from spending more, noted a review on the myths of anti-aging skincare, but, quote, don't be seduced by fancy packaging and high prices, unquote. Many products advertise dramatic results that are frequently exaggerated and misleading and are rarely supported scientifically. An independent product testing institute questioned the efficacy of anti-aging creams generally, finding that beneficial effects could only be picked up using sensitive instruments without becoming clinically detectable, and suggested these products may not work any better than typical moisturizers. Cross-sectional studies of Chinese and British women found that those who regularly use facial moisturizers were guessed to be about 2 years younger than women of the same age who didn't. However, a third larger Dutch study did not. Regardless, snapshot in time studies can never establish cause and effect. Studies on moisturizers are limited, but they can improve the appearance of dry skin, which can otherwise look discolored, flaky, and rough. Moisturizers can hydrate the skin, may reduce the appearance of fine wrinkles by 15 to 20%, called, quote-unquote, the oldest trick in the cosmetic industry. But they may not do anything to treat the underlying cause. Daily SPF 15 Facial Moisturizer. Whether facial foundation, night cream, or anti-aging quote-unquote serum, the formulations of most skin products are basically a moisturizer combined with purported active ingredients for marketing appeal. Which ingredients are actually active anti-aging agents? I bet you can guess which is the single most effective skincare component out there when I offer a hint, the reminder that up to 90% of the visible aging of someone's face is due to sunlight. From an anti-aging standpoint, the most biologically active ingredient in skin products is sunscreen. Considered the single most important practice for maintaining youthful skin is the daily application of sunscreen and employing other protective measures like wearing a hat. Everything else you can do for your skin pales in comparison, especially for those with pale skin. UVA rays are primarily responsible for skin aging, whereas UVB are the rays that cause sunburn. A broad-spectrum sunscreen covering both is recommended since both types of UV contribute to cancer risk. To prevent skin cancer, the American Academy of Dermatology recommends sunscreen with an SPF of 30 or higher, but an SPF of 15 can prevent skin aging. How do we know? Because it's been put to the test. 900 adults were randomized to years of recommended daily sunscreen use or continuing with their own discretionary use. It was considered unethical to withhold protection by giving people placebo sunscreen. In the end, 77% in the recommended daily sunscreen group applied sunscreen at least 3 or 4 days per week, compared with only 33% in the discretionary use group. Would that be enough of a difference to make a difference? Yes. There was significantly less skin aging in the instructed daily use group. In fact, they suffered no detectable increase in skin aging over the 4.5-year study. The researchers concluded, quote, regular sunscreen use retards skin aging in healthy middle-aged men and women, unquote. Although sunscreens are primarily intended to prevent further facial aging rather than reverse pre-existing photo damage, some in the daily sunscreen use group did show an improvement in skin texture. The results are all the more striking given that the control group was told to continue to use sunscreen and hats whenever they thought it would be needed, suggesting people are poor judges or planners for excess UV exposure when left to their own devices. So, a daily facial moisturizer with an SPF 15 is recommended even if it's cloudy or raining outside. Considered the gold standard for anti-aging skincare, quote, daily use of sunscreens in the daytime and retinoids at night, unquote. Nightly retinoids? While sunscreen can prevent further skin photoaging, tretinoin can reverse some of what's already been done. Also known as all-trans retinoic acid, sold under a variety of brand names, including Retin-A, tretinoin is a prescription-only form of vitamin A that can visibly improve mild to moderate photo damage, including fine and coarse wrinkles, freckles, and other pigmentation, and improve overall skin texture after months of regular use. Though it can cause redness, stinging, burning, itching, and peeling in a high proportion of patients, there are gentler, less potent over-the-counter topical retinoids, retinaldehyde, retinol, and retinol esters like acetate, palmitate, and propionate. I compare and contrast them in C.NF/retinoids. Of all the non-prescription retinoid options, retinol may be their preferred choice, but tretinoin has by far the most robust track record of efficacy, so why not ask your doctor for a prescription? Because, as I detail in the video, long-term topical tretinoin use may increase your risk of an even more stinging side effect: premature death. Topical nicotinamide. What other skin cream components have been shown to help with skin aging? While placebo-controlled trials are the standard in most medical research, they're still all too rare for cosmetic products. This raises efficacy questions, so many are left with simply buying hope in a jar. This also raises safety concerns. To this day, cosmetics contain an array of toxic chemicals. Of the more than 12,000 synthetic compounds used in cosmetics, less than 20% have been recognized as safe. Of course, this doesn't mean natural ingredients are necessarily harmless. Poison ivy is as natural as you can get, but you wouldn't want to rub it onto your face. However, there are some relatively safe natural options with varying degrees of efficacy. Topical nicotinamide, also known as niacinamide, is a form of vitamin B3 that is non-irritating, has been described as one of the best-studied cosmeceutical ingredients for anti-aging. But it looks like there's only 3 placebo-controlled human studies, which gives you an idea of the state of cosmeceutical science. Skin photoaging is largely mediated by UV-induced free radical formation. One of the consequences of excess sun exposure is the oxidation of sugars and proteins in the skin into yellow-brown pigment that gives aging skin a yellowing, sallow appearance. Since nicotinamide is a precursor to 2 potent antioxidants, the hope is that this process could be interrupted, as revealed in the first study, titled "Topical Niacinamide Reduces Yellowing, Wrinkling, Red Blotchiness, and Hyperpigmented Spots in Aging Facial Skin," unquote. In a 12-week, double-blind, placebo-controlled, split-face, randomized clinical study of middle-aged women. In a split-face study, each subject is her own control. The active formulation, in this case of 5% nicotinamide and moisturizer, is rubbed on one side of her face, and the placebo straight moisturizer on the other side, though neither she nor the researchers know which side is which until the code is broken at the end. This controls for skin type and administration techniques, since different people apply facial products differently. However, people often use the same hand to apply creams to both sides of the face, so unless specified that different gloves be worn or hands washed in between, there can be cross-contamination. At the end of 12 weeks, there was a small 5% reduction in wrinkles and fine lines and a slowing in the development of blotchiness, spots, and sallowness on the nicotinamide side of the face. A subsequent publication noted an improvement in skin elasticity as well. The magnitude of the effects may only be 1/3 to 1/5 as good as tretinoin, but there were no reports of excess skin irritation. The other 2 studies were similar split-face trials, but with 4% nicotinamide products. One study found no significant effects on facial wrinkles compared to placebo, but the other, which was limited to crow's feet wrinkles around the eyes, found significant improvements in both subjective and objective measures by the end of the 8-week study. 64% of the nicotinamide side eye wrinkles underwent moderate or marked improvement compared to 0% on the placebo side. Topical vitamin C. If skin aging is mediated by oxidative stress, why not just directly apply antioxidants like vitamin C? Topical application of antioxidants can lead to levels in the skin that are 10 times what is achieved with oral dosing, at least in the skin of mice. According to a recent review on topical anti-aging skincare by a prominent Beverly Hills plastic surgeon, quote, "At a minimum, patients should be encouraged to use daily sunscreen, a topical retinoid at night, and a topical antioxidant daily," unquote. But which antioxidant? Only one has been clearly shown to work. Despite its ubiquity in skincare products, there's no evidence to support any role for topical vitamin E in skin aging, whether for wrinkles, discoloration, or texture, and the one study on topical CoQ10 found it also failed to work significantly better than placebo. There is, however, one type of vitamin C that has been shown to help. Skin biopsy studies show that the topical application of a 5% solution of L-ascorbic acid, also known as just ascorbic acid, the type of vitamin C found in food, significantly increases the expression of collagen in human skin compared to placebo, suggesting, quote, "functional activity of the dermal skin cells is not maximal in postmenopausal women and can be increased," unquote. A split-face study involving the application of 3 drops of a 10% L-ascorbic acid solution for 3 months found significant improvements over the placebo side of the face in fine and coarse wrinkles, sallowness, and skin tone or firmness. Not knowing which side was which, 16 out of 19, 84% of patients correctly guessed the vitamin C side as the one showing improvement. Unfortunately, L-ascorbic acid is unstable in creams. It turns an unsightly brown when it oxidizes, limiting its shelf life. So, instead, the skincare industry uses more stable vitamin C esters or derivatives, such as ascorbyl palmitate, ascorbyl stearate, magnesium ascorbyl phosphate, or ascorbic acid sulfate. Unfortunately, there's no evidence that these compounds have comparable effects, likely because they're poorly absorbed and only minimally convert to the active form. The good news is that you can make your own. Although vitamin C concentrations as low as 3 and 5% have been shown to have an anti-wrinkle effects in split face or split neck and arm studies, at least 10% is recommended. The 10% solution used in the aforementioned split face study retails for a ridiculous $127 per ounce. You can make a DIY solution by simply buying L-ascorbic acid in bulk and mixing 3 grams into 30 grams of water at a cost of about a nickel per ounce, thousands of times cheaper. You can mix it in an eyedropper bottle, drip just 4 or 5 drops onto the palm of your hand, and use your fingertips to apply it over your face, neck, and upper chest daily. Just be careful not to get it into your eyes, though. A sidebar: alpha-hydroxy acids. There's a reason there's a long historical use of fruit purees as facial masks. Alpha-hydroxy acids, also known as fruit acids, are used at high-strength concentrations in chemical peels, but lower concentrations are sold over-the-counter as exfoliants. I'll review the 4 placebo-controlled trials in C.NF/alpha. In some, alpha-hydroxy acids can help with past photo damage, but they may make future damage worse by increasing skin photosensitivity. Skin cancer. More than 3 million new cases of skin cancer are diagnosed every year, affecting about 1 in 3 Americans in their lifetimes. Risk increases with age, and the incidence has been on the rise. Should we get screened for skin cancer by getting periodic full-body exams? The Skin Cancer Foundation recommends annual physical exams, but the official U.S. Preventive Services Task Force position is that there's insufficient evidence to support any interval of skin screening. This is based in part on a national experiment in Germany. In 2003, a total body skin exam screening campaign was started in the German state of Schleswig-Holstein. By 2008, melanoma mortality rates had dropped by nearly 50%. Given the apparent resounding success, the program was expanded nationwide in 2009. Sadly, 5 years later, there was no significant change in melanoma mortality. In fact, national rates had even crept up a bit, and the apparent gains in Schleswig-Holstein vanished back to baseline. Was the original drop just due to chance? More nefariously, some have suggested that German doctors, motivated by the financial incentive, a per-screening bonus of €15, about $20, started to intentionally or unconsciously underreport melanoma on death certificates to make the program appear effective. Either way, skin screening has not yet been shown to save lives. Note that the USPSTF's lack of endorsement for regular medical skin screening is only in reference to the mass screening of asymptomatic healthy individuals. If you have a suspicious mole or are otherwise at heightened risk due to a personal or family history of skin cancer, you should definitely bring it up with your healthcare provider. The ABCDEs of mole suspiciousness for melanoma, the deadliest form of skin cancer, are A for asymmetry, B for border irregularity, C for multiple colors, D for diameter, larger than a pencil eraser, and E for evolving, a change in size, shape, color, elevation, or symptoms such as bleeding, itching, or crusting. Basically, any lesion that's new, changing, or unusual compared to other moles is suspect. Slip, slop, slap, seek, slide. If universal screening isn't going to save us from skin cancer, what will? The same and best way to reduce the risk of all common cancers: primary prevention. In other words, preventing the cancer from emerging in the first place. Here's another mnemonic: Australia's SunSmart 5S's program featuring Sid the Seagull. Slip on clothing, slop on sunscreen, slap on a hat, seek shade, and slide on sunglasses. A single blistering sunburn on a child may double the risk of developing basal cell or squamous cell skin cancers later in life, whereas regular use of sunscreen during childhood has been estimated to reduce the incidence of these cancers by 78%. Ideally, protective clothing should fully cover the arms and legs. For regular clothes without an ultraviolet protection factor or UPF tag, densely woven, thicker, and darker cloth tends to be more protective. You can hold a garment up to the light and see whether it shines through. Hats should shade the whole head. Wraparound sunglasses can better shield the delicate skin around the eyes that may not be protected by sunscreen. And lip products with at least 30 SPF should be applied generously to fully cover the lips. A sidebar: oral nicotinamide. After decades of use in the cosmetics industry to prevent skin aging, researchers decided to put nicotinamide to the test for skin cancer prevention. Normally it'd be difficult to fund studies on non-patentable products that only cost a few cents a day, but preliminary findings were so extraordinary that OnTrack was born. Oral nicotinamide to reduce actinic cancer was a publicly funded Phase 3 efficacy-determining trial, randomizing hundreds of people with personal history of skin cancers to 500 milligrams of nicotinamide or placebo twice a day for a full year. By the end, there were 463 new skin cancers in the placebo group versus 336 in the nicotinamide group, about 25% fewer cancers with no significant side effects for just pennies a day. Details in c.nf/cancernic. What about sensible sun exposure? The UV rays in sunlight are considered to be a complete carcinogen, meaning they can not only initiate cancer but also promote its progression and spread. The incidence of melanoma, the scariest kind of skin cancer, has tripled over recent decades, in part likely due to the increased use of tanning salons. Tanning beds and their UV rays are considered to be a Class 1 carcinogen like tobacco, asbestos, plutonium, and processed meat. For more on tanning, check out c.nf/tanning. Unlike natural sunlight, tanning bed lights emit mostly UVA, which is the worst of both worlds, cancer risk without any vitamin D production. Sunlight supplies 90 to 95% of vitamin D for most people. In fact, as I detail in c.nf/sun, modeling studies suggest that low vitamin D levels from sunlight avoidance may kill more people than the skin cancer from sun overexposure. So on balance, the benefits of quote-unquote sensible sun exposure might outweigh the risks, but why accept any risk at all when we can get all the vitamin D we need from supplements? In fact, the model got those estimates on preventing internal cancers with vitamin D from intervention studies involving giving people vitamin D supplements, not exposing them to UV rays. The sun debate is framed as needing to choose between the lesser of two evils, skin cancer or vitamin D deficiency. But this framework ignores the fact that there's a third way: vitamin D supplement. A sidebar: black salve swindle. Skin cancers are usually just excised, but what about using black salve instead? Listed as a fake cancer cure by the FDA and similarly condemned by the American Academy of Dermatology, black salve is still promoted on the internet as a so-called natural alternative remedy for skin cancers. I detail how damaging and dangerous it can be in c.nf/salve. Some cancer patients are duped by disinformation, but many who refuse conventional therapies describe their oncologists as impersonal, intimidating, cold, uncaring, unnecessarily harsh, thinking they were God or not even knowing their names, and becoming adversarial when questioned about recommended treatments. Few believed their doctors had their best interests in mind, and many said that they would have been more likely to initially accept conventional treatment had they felt they had caring physicians who treated them with respect. Sunscreen proven to prevent cancer. As I noted before, there are randomized controlled trials that have shown that regular use of sunscreen can arrest signs of skin aging, including biopsy-proven reductions in UV-related skin damage. But are there interventional trials proving that sunscreen can prevent cancer? Yes. In fact, it can actually reverse the progression of precancerous skin growths, causing them to spontaneously regress and vanish. I profiled the mind-blowing study in c.nf/sunscreen use. The body can sometimes heal itself once we stop bombarding it with so many cancer-causing rays. Proper sunscreen use. For maximum effectiveness, sunscreen needs to be applied properly. Several studies have demonstrated that this rarely happens, with as few as 1 in 25 complying with recommendations. In the same video, c.nf/sunscreen use, I detail the proper amount using the so-called teaspoon rule, why SPF 50+ is often recommended, even though SPF 15 should theoretically be enough to prevent cancer, how cloudy skies can sometimes even be worse, and timing of application before and after water and sand exposure. A sidebar, it's black and white. The average built-in SPF of black skin, also known in the medical literature as so-called ethnic skin or SOC, skin of color, is 13, compared with only 3 for white skin. Though there have been no interventional studies on sunscreen effectiveness for skin cancer prevention in people with darker skin, SPF 13 is not considered sufficient sun protection. So the American Academy of Dermatology recommends regular sunscreen use with an SPF of 30 or higher for people of all skin shades. Unfortunately, only about 12% of non-Hispanic blacks and 31% of Hispanics report regularly using sunscreen, compared to around 44% of non-Hispanic whites. Despite this, the incidence of melanoma, the deadliest skin cancer, is 5 times lower in Hispanics compared to whites and 25 times lower in blacks. However, the mortality rate, if melanoma does develop, is higher among blacks, presumed to be from delayed diagnosis. Photoaging in darker skin is less likely to appear as wrinkles and more likely to appear as pigmentation issues, such as uneven skin tone, melasma, which is dark patches, and dermatosis papulosa nigra, small dark bumps on the face. To combat skin aging and cancer risk, transparent chemical sunscreens are often marketed to those with darker skin, since the mineral sunscreens, like titanium dioxide and zinc oxide, often leave a white residue. However, there are now micronized mineral sunscreens that are much less visible after application. Mineral Right. What kind of sunscreen should you use? Cream-based is preferable to spray-on, since it's easier to see where you've applied the sunscreen. To help with adequate coverage, spray-on sunscreens should be rubbed around immediately after spraying. I don't recommend aerosolized sunscreens. They're flammable and can combust on the skin upon exposure to an open flame, even after the sunscreen is dried. What's more, the safety of breathing in aerosolized sunscreen chemicals has not been adequately studied, though frankly the same could be said about rubbing them on your skin. As I detail in c.nf/safest sunscreen, concerns about the systemic absorption of sunscreen chemicals was underscored by the 2019 FDA bombshell that none of them can be considered generally recognized as safe. Only 2 active ingredients got the green light: the 2 non-chemical mineral sunscreens, titanium dioxide and zinc oxide. The revelation was based on a growing body of evidence that transdermal, through-the-skin absorption of sunscreen chemicals was greater than we thought, raising quote-unquote previously unevaluated safety concerns. Unevaluated because previously we didn't think so much got into our bloodstreams. Trim the fat. Other than nicotinamide, how else might we protect against skin cancer from the inside out? Based on studies showing that high-fat diets accelerated skin cancer formation in mice, and population studies showing higher cancer rates tied to higher-fat diets, the National Cancer Institute and a Veterans Affairs research team published striking results in the New England Journal of Medicine showing that randomizing those with a history of skin cancer to a lower-fat diet resulted in a 10-fold drop in skin cancer rates. Details in c.nf/low-fat-skin. Varicose veins. Varicose veins are not just a cosmetic issue. They can be associated with feelings of pain, heaviness, and itchiness. Compression stockings were traditionally the standard therapy for management of symptoms, but over the last decade, the lack of evidence for compression efficacy, combined with the development of minimally invasive endovenous ablation techniques, have shifted treatment recommendations. Details in c.nf/varicose. However, neither treats the underlying cause. Before we get to that, a sidebar: topical vinegar. In C.NF/vein, spelled VEIN, I profile a study titled The Effect of External Apple Vinegar Application on Varicosity Symptoms, Pain, and Social Appearance Anxiety, a randomized controlled trial. Topical vinegar, not pee, can help with jellyfish stings, but not eczema. What about varicose veins? See the video for details, but the potential harms of applying undiluted vinegar probably outweigh the questionable benefits. Anti-varicosity diet. In Uganda, a survey found only 6 cases of varicose veins out of 5,000 adults. Perhaps rural Africans had more than 50 times fewer varicose veins. For the same reason, they had 50 times less heart disease, up to 50 times less colon cancer, and up to 50 times less of other pressure diseases such as diverticulosis, hiatal hernia, and hemorrhoids. Because their diet was so packed with whole plant foods, rural Africans were among the only known populations ever recorded eating more than 100 grams of fiber a day, which is the amount that is considered normal for our species. I mentioned in the Preserving Your Bowel and Bladder Function chapter in detail in C.NF/varicose how straining at stool can push blood flow back into the legs and cause the valves in the veins of our legs to fail. The root cause of straining is the effort needed to pass unnaturally firm stools, but we can treat that cause by eating enough fiber-containing whole plant foods to create stools so large and soft that you can pass them effortlessly. Given the fiber connection, it's no surprise that Western vegetarians also have lower rates of pressure diseases like diverticulosis, hemorrhoids, and varicose veins, but that might not be the only reason. A study of elderly vegetarians found they also have much lower incidence of varicose veins under the tongue, as well as fewer sublingual bleeding capillaries, a condition known as caviar tongue. Given the dilation of veins and thinning of blood vessel walls characteristic of scurvy, the researchers suspect the low rates of varicose veins in vegetarians may also have to do with their greater vitamin C intake. Nail health. According to the American Academy of Dermatology, nearly everyone will experience some sort of nail disorder during their lifetime. As we age, our nails grow more slowly, become more brittle, and can start to appear pale, dull, and opaque. Starting around age 25, nail growth rates slow by about half a percentage point a year, perhaps one of the reasons we're more likely to be affected by nail fungus as we get older, the most common of nail disorders. The prevalence of nail fungus, also known as onychomycosis, rises from about 2% in our youth to 20% over the age of 60 and affects around half of 70-year-olds. Treating fungal toenail infections. Nail fungal infections typically strike the toenails, causing nail discoloration, deformity, detachment, thickening, crumbling, and ridging. They're stubborn to treat as the fungus can hide deep inside the nail, protected from the blood supply on one side and anything you put on it topically from the other. So even if you're able to beat it back, it often recurs due to residual infection. Onychomycosis is most commonly treated with an oral antifungal drug because they're so much more effective than topical antifungals, but they carry more side effects and drug interactions. Terbinafine, sold as Lamisil, is typically the drug of choice for treatment in the elderly. It can cause a metallic taste in the mouth by the second month of treatment, and skin rashes are common, sometimes severe. Other common side effects include headache and gastrointestinal symptoms, with rare cases of liver, kidney, and heart failure. Cure rates in the elderly from oral antifungals are only about 64%, but that's a lot better than the topical drugs. Oral antifungals are typically given for 12 weeks for toenail infections, whereas topical antifungals may take 12 months. Fingernail fungus is usually treated in half the time. Such long treatment courses can limit patient compliance, especially among those who want to use nail polish to cover it up. And even after a full year of daily application, cure rates for most topical medications are only about 9% versus around 1% for a placebo. There are some newer topical agents that can be applied once or twice a week that may work better, but apparently not significantly so. Given the poor response rate, topical treatment alone is generally only recommended in mild cases or when oral drugs are contraindicated. For example, terbinafine is not recommended for people with liver disorders. To increase the cure rates, oral and topical treatments can be combined based on in vitro data on the antifungal effects of an acidic pH, Some recommend nightly diluted vinegar foot baths of half water and half vinegar before topical antifungal application. What about other natural remedies? Diluted tea tree oil appears to help against the fungus that feeds on your scalp to cause dandruff, and the athlete's foot fungus between your toes, so what about topical application for nail fungus? As I detail in c.nf/tea tree, it was pitted head-to-head against the popular antifungal medication clotrimazole, sold as Lotrimin, in a double-blind or randomized controlled trial and was found to be comparable in efficacy of cure, clinical assessment, subjective improvement, and even cost. Even better, though, is to treat the underlying cause. Before I get to that, though, a sidebar: preventing and treating ingrown toenails. While fingernails tend to become thinner with age, toenails can become thicker and harder, making them more difficult to cut. To prevent toenails from becoming ingrown when the side or corner of the nail digs into the adjacent flesh, toenails, especially on the big toe, should be trimmed straight across. Unlike the curve you get trimming your fingernails, the top of your toenail should make a straight line. You can round the corners, but the nail should always extend beyond the skin on both sides. Another main cause of ingrown toenails is ill-fitting footwear. Shoes that are too tight or small can push the skin of your toe into your nail. Minor ingrown toenails can be treated at home with cotton packing. As soon as you feel the corner of your toe getting inflamed, twist off a wisp of cotton from a cotton swab or a cotton ball, insert it under the corner of your nail, and try to stuff it under and along the lateral edge of the nail to protect the underlying skin. Although it can be painful to get it in there, you should experience immediate relief when it's in place. Obviously, if it continues to get worse, see a healthcare professional. Preventing fungal toenail infections. First, there's the pathogen. The leading culprit is the same fungus that also causes jock itch, ringworm, and athlete's foot, so keeping feet clean and dry can help prevent the foot from being a fungal reservoir. Then we can prevent fungal penetration of the nail by making sure nail grooming instruments are sanitized. Even sharing nail polish can be risky, as the fungus can live for months in top-coat products. Artificial nails can put fingernails at risk, presumed to be because the acrylic nails trap dampness that would otherwise evaporate through the nail. Due to the low-fat content of nails, they're normally about 1,000-fold more permeable to water than skin. Then there's the host. Fungal nail infections may be a manifestation of poor peripheral blood circulation that would normally allow your body's natural defenses to keep the fungus from taking root in the first place. A study of 400 patients found a greater than 50% reduction in blood flow in patients with athlete's foot and nail fungus compared to patients without. So fungal nail infection may just be a symptom of an underlying process such as declining immunity or circulation, which can help explain why the eradication of these infections can be, quote-unquote, unrealistic. This has led to a fatalistic response. Quote, a more appropriate goal may be the amelioration of symptoms, unquote. But if circulation is a problem, why not instead try to improve the circulation? We've known since the 1950s, from one of the first dietary cardiovascular disease reversal studies ever published, that you can effectively turn peripheral artery disease circulation on and off like a light switch within days just by switching people between a low-fat plant-based diet and the more conventional diet that contributed to the problem in the first place. Before we get to brittle nails, a sidebar: separation anxiety. Many over-the-counter products purport to improve nail quality, but little evidence supports these claims, and the products can sometimes even make things worse. Cuticles serve a function. They're a barrier to pathogens and should be left in place, not cut or pushed back. The nail surface shouldn't be filed, as the thinning may make the nail prone to split, and sharp objects should not be placed under the nails, as they can breach the onychodermal band, the natural smile line that seals the nail bed against infection, which can increase the risk of onycholysis, the partial separation of the nail from the nail bed. Acrylic nails can also be a predisposing factor for onycholysis, as the adhesive can be stronger than the natural bond between the nail and the nail bed. The accumulation of moisture beneath artificial nails can also make the nail more likely to detach. Nail hardeners are another potential cause because they contain up to 5% formaldehyde, also listed as formalin or methylene glycol on the label, which can cause inflammation that can lead to nail separation. How to prevent brittle nails. Brittle nails affects about 1 in 5, with women affected about twice as frequently as men. Reported risk factors include dehydration, certain chemicals, and trauma. A common trope is that nail hardness depends on nail hydration. Nails become soft when overhydrated and are said to become brittle when they get too dry, leading to advice to soak brittle nails every day and apply nail moisturizing creams, oils, or ointments. When actually put to the test, though, the water content of brittle fingernails didn't seem significantly different than that of normal fingernails. In fact, the brittle nails had slightly more water. What did appear linked to the risk, however, tripling the odds of brittle nails, was professional manicures. Rather than manicures leading to brittle nails, might those with brittle nails just be more likely to get manicures? Nail cosmetics, including nail polish removers, solvents, nail hardeners, cuticle removers, and premixed acrylic gels, as well as procedures such as nail wrapping and nail sculpturing, can weaken the very structure of the nail. You'd think nail hardeners would help, but again, the formaldehyde in these products may do more harm than good in the long run. At home, choose non-acetone nail polish removers like acetate, and try to minimize use to once a week or less, as they are considered a major cause of brittle nails. Artificial nails can protect brittle nails, but the problem is that removal is always traumatic for the nail, and prolonged use may weaken the nail by reducing oxygen transport. Finally, prevent trauma by avoiding filing the surface of your nails or subjecting them to repetitive stress, such as from typing. Biotin for brittle nails? Biotin supplements for nail growth are popular, but as explored before, the same could be said about biotin for hair growth, and in that instance, biotin was a total flop. Could the same be said about biotin for nails? We don't have a good sense, since there apparently hasn't been a single placebo-controlled trial published on the matter. Where did anyone get the idea that biotin might help? Serious biotin deficiency is associated with poor nail quality, though this tends to only strike those who eat raw egg whites. Biotin works in ponies, affecting a 15% increase in hoof horn growth rate. Their hooves are made out of the same stuff as our nails. But what about biotin in people? There have been 2 uncontrolled before versus after studies that suggest 2.5 milligrams of biotin a day may help. One trial showed a 25% increase in nail thickness after 6 to 15 months. There's only been one controlled trial, though, once a day for 4 months. Brittle fingernails were treated with nail lacquer with or without taking daily 10 milligram supplements of biotin. Nail appearance improved substantially in 80% of the biotin group versus 53% in the control group. Unfortunately, at that dose, biotin may disrupt laboratory measurements. For scheduled blood tests, like thyroid function or pregnancy, you may want to stop the biotin 1 to 5 days before the blood draw, depending on how much you're taking. The FDA was prompted to put out warnings about biotin after a case where biotin interfered with a test called troponin that would have revealed a missed heart attack, and the patient died. Those are the kinds of tests you can't foresee. A survey of dermatology outpatients taking biotin found that only 7% had ever heard about the FDA warning, and a nationwide survey of physicians also showed that there were significant professional knowledge gaps. A dose of 2.5 milligrams a day may be too low to interfere with lab results, so it may be worth a try for brittle nails, even though we don't have firm evidence that it will help.